Okay, so welcome to In the Pod. I'm your host, Senior Educational Psychologist, Heather Altinok-Ball. And today we're in a conversation with Tina Coope and Vicky Burford from PANS PANDAS UK. How are you both doing?
We're both good. Thanks, Heather. It's lovely
Thank
to be on the
you.
podcast. Thank you for inviting us.
Lovely. Well, thank you for joining us to talk about a really interesting topic today. So I guess, first of all, Vicky, can I hand over to you to introduce yourselves, your roles, and a bit more about what PANS PANDAS stands for and what the charity does?
Yes, of course. Well, it's great to be here. Thanks for having us. So my name is Vicky Burford. I am the CEO of PANS PANDAS UK and also one of the original co-founders of the organisation back in 2018.
Hi, my name is Tina Coope and I'm the educational lead for PANS PANDAS UK. So I'm a former teacher and also a parent of a child who developed the severe onset of neuropsychiatric symptoms at the age of 7. And she's now 19. So we've been negotiating a health and education journey for around the last 12 years.
Can you just explain a little bit more about PANS PANDAS and how the charity was founded, and a little bit more about really what you're about?
Yeah, of course. I'd like to do that. So PANS and PANDAS are acronyms for very, very long names. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. And PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. Hence the reason that we use the names PANS and PANDAS, because nobody wants to say that too often. So PANS and PANDAS are post-infectious inflammatory conditions, which usually come on quite suddenly after an infection. So they're conditions you probably have never heard of. Most people haven't. And they are, in fact, two conditions. Many people call them PANS PANDAS and kind of group them together, but they are, in fact, two distinct conditions. You have PANDAS, which affects children primarily between the ages of about 2 and kind of puberty. And that is caused by strep. So we know what the trigger is for that condition. And it is a subset of PANS. And PANS, which is the overarching diagnosis, can be caused by any infectious trigger at all. So it can be caused by a flu, it can be caused by COVID, it can be caused by chickenpox, any kind of infection, whether that's viral, bacterial, fungal, it can cause a reaction, which we call PANS. Another feature of PANS is that it can affect adults as well. So whereas PANDAS is just for children, really, PANS can affect anybody at any age, post-infectious. And in the case of children who are not treated, the symptoms can continue with you into adulthood. So whilst it's considered a pediatric condition, actually it can affect adults. The symptoms can continue if they're not treated. They don't just disappear at the age of 18. A little bit about the symptoms. I'm not going to go into lots of detail here because all of this information is on our website, but the primary symptoms for the conditions are OCD, tics, and they can be motor tics or verbal tics, and eating restrictions. So there are 3 primary symptoms and then a range of secondary symptoms which are also seen with these conditions, and they include anxiety. So separation anxiety, really severe separation anxiety is a very common one. There's behavioural regression, educational regression, emotional lability, rage, anger, depression, lots and lots of these sort of emotional type of symptoms. And then there's also symptoms such as insomnia and enuresis, or, bedwetting, like where a child's been dry before and suddenly is not dry anymore. And in about 25% of cases, there are also reports of hallucinations and delusions as well. So it can be really frightening condition to have. What's difficult is that there's no diagnostic test. So it's a clinical diagnosis, and it is a diagnosis of exclusion, which means everything else that could be causing these symptoms has to first be ruled out before the diagnosis of PANS and PANDAS can be made. So that causes a number of challenges, as I'm sure you can understand. So we are the only charity in the UK supporting people affected across all 4 nations of the UK. We have 3 key work streams. So we work across health and education, and then we support the community We support over 7,500 families now. And our work really focuses heavily on influencing policy at the moment. We're a very, very small charity. We work extremely hard. And yeah, I think that's it really. We started in 2018, a group of very passionate parents who came together on a Facebook support group, decided that something needed to be done about the fact that these children were not getting any kind of treatment. And, from 2018 to where we are now, I think we've made a significant amount of progress. There's still a long way to go. And, things like this podcast are really, really helpful for us to get the word out there. So thank you for having me.
Oh, you're more than welcome. Thank you, Vicky. That was really helpful in terms of a wider explanation. So I'm wondering, in terms of the listeners, I think majority of people that will be listening to this podcast are educational psychologists, and it'd be really helpful for us to understand a little bit more about the impacts of PANS or PANDAS and what the outcomes are for families that you've worked with. Generally speaking, kind of what do we need to know about the impact that this diagnosis may have, or not having a diagnosis but still presenting with those symptoms? What's the impact that we need to know about?
Okay, so I can tell you a little bit about the more general impact, the sort of the wider view, and then Tina could probably give you a bit more information about what in the classroom and educational impact on the child. So we know that early detection and prompt treatment results in better outcomes for our families. We know that. We see it every single day. And whilst awareness is growing, that early detection is still really, really rare. So what tends to happen is a child will develop these symptoms. They'll be taken to their GP, and the GP will refer them to CAMS, because what these children look like, they look as if they have some kind of mental health illness. So they'll be sent to CAMS. We all know that there's a real delay in accessing care from CAMS. So we might be looking at an 18-month delay before a child is even seen, by which time a lot of those symptoms have become really quite severe, and it can be much more difficult to treat. So what we see is that these children, for many of them, they become so poorly they can't attend school. Those kids, then one of the parents, if there are two parents in the family, one of them has to stay home to look after the child. Very often the school setting refers social workers in, because this child's not at school, and they might not have a diagnosis yet, so they don't actually know what's wrong with the child. They just see the child is not at school, and things really tend to escalate. And very often we see families break down, we see homes lost, we see that impact goes really, really wide across the whole family, and that whole child's community. Obviously, I'm talking about children who are not in school, and there is a significant number of our children who are not able to attend school. But then, of course, we're here to talk about the children who are in school, and that's where Tina will be able to give you more information.
Brilliant. So thinking about kind of educational impact then, Tina, kind of what do you see in terms of outcomes and impact for this group of children when thinking about being in school or across education?
So I think it's important to outline that we don't have a lot of long-term educational data. So it's difficult to say about the long-term outcomes with any certainty. What might be helpful to share is what you might see in the classroom. And in essence, you're looking for multiple unexplained changes in children. And these changes can cover all 4 areas of the code of practice. They can be very unexpected. There can be no prior indication of needs in some cases, and they can come on very abruptly. So some of the things that you might see, and every child is different and presents differently, are academic regression, so a loss of previously established skills and this fluctuating performance. You can see executive functioning difficulties, so with planning, taking in instructions, working memory can be impaired, and processing speed. And again, it's unusual for these to be that acute change. As Vicky's covered, we often then get a lot of attendance issues, can also be social difficulties, peer isolation. Sometimes children are stigmatized, can be bullied. And there's impacts on identity and self-esteem of developing sudden onset SEND. and also emotional dysregulation, anxiety, mood swings, OCD traits. There's a really wide, potentially wide range and scope of needs, often fluctuating, changeable, and they can vary within flare to flare. So children get the flare-ups of their neuropsychiatric symptoms. And in some children, every time they get a flare-up, they have a similar spectrum of symptoms. But in other children, you'll get new symptoms, or symptoms are more or less severe. And there's a real risk, I think, of chronic impairment in these conditions when we don't pick up them early and provide that, medical treatment as well as the right support in the classroom.
Mm-hmm. And as you're talking, Tina, it's making me think about that psychological adjustment. So when those flare-ups are happening, you mentioned about identity and shifts in identity, that there's a lot of psychological adjustment that possibly needs to happen at multiple times through a child's development. And I wonder if the age and stage of development that they're currently at when they're initially diagnosed or when the symptoms present versus potentially later flare-ups, whether actually that adjustment process might look different. It might look different in a primary school to a young person who's going through adolescence, for example, when we think about what's happening in adolescence anyway in the brain and development, whether that psychological adjustment is actually quite different at that stage. And perhaps we need to understand that childhood development trajectory in terms of psychological adjustment to symptoms that might present in PANS or PANDAS. So sorry, Tina, are you going to say something else?
I was just going to say, absolutely. And that's where we've got that real lack of research, and we've got that lack of interrelated research between education and health in terms of on age of onset, how many flares a young person or child has, how long, how severe those flares are. And as you've said, all of those periods of sort of interruption within their childhood and how it impacts on children, depending on what age they develop this and how long, the duration of it is.
Mm-hmm. And what support mechanisms are around them, and how much that support system understands what they're experiencing, and the professional understanding as well as kind of school systems understanding what this young person might be experiencing. So if you were to be able to kind of give key messages to an EP about what they might need to know about PANS or PANDAS, what would be the key messages that you feel educational psychologists really would need to know when working with a young person who might be impacted?
So firstly, that there's really low awareness of the conditions, and that's education, social care and health professionals, obviously from their own perspective, but also in terms of consulting with wider professionals. So to check that everybody has an understanding of the conditions. I think what's also really helpful to understand is some of the unusual characteristics. These are medical conditions and can only be diagnosed by a medical professional, but they do have some distinctive characteristics in education that supports delineating them from perhaps other conditions or neurodivergent. For example, the typically abrupt onset, the sudden onset of SEND needs, and also you can have deterioration in established skills such as fine or gross motor skills. Handwriting can deteriorate, for example. And then I think another key thing for EPs to be aware of is that in these cases, it's the health needs that have led to the development of special educational needs. And so therefore the health needs need to be met as well as the support in the classroom. Mm. Also, what a lot of families I know really struggle with as a barrier is that their children may be masking in the school environment. And again, I think this is very interesting in terms of research, because of course these children were typically operating at a different level in the classroom. They're very aware typically of the scope and range of symptoms that they have developed. They might not know why they developed them and why they can't do things anymore in the way that they could, but how that may potentially influence how you mask in the classroom, I think is very underexplored, and there's a lot that we don't know. And also we've got a current lack of incidence figures, so something else for EPs to be aware of. We've got more than 7,500 families in the Facebook support group. We're not saying they've all got PANS and PANDAS, but they are all reporting the sudden onset of neuropsychiatric symptoms in their children. So clearly the scale of this is yet to be realised.
Yeah, okay. In terms of thinking about key areas, key strategies, or kind of key areas of work that educational psychologists could contribute to here, what would you say they could be?
I think early identification is absolutely crucial for the EP's role. And part of that, what we've kind of learned through our families, is giving equal weighting to all of the signs and the scope and range of those symptoms, so that those initial assessments really do capture a change in presentation for the child with equal weighting to all of those changes. And also being aware then that school staff who may be conducting those assessments may not be aware of PANS and PANDAS, and how that perhaps may also influence the assessment that they are doing. So I think for EPs to kind of capture the change and the fluctuations, and to think on a practical level, because obviously resource is scarce, on a practical level, what that may look like for a child in a school would be crucial. Other things that we think about are how to adapt those interventions to adhere to this fluctuating pattern of need, and knowing that perhaps there's a reduced ability to absorb cognitive information. And so we would generally suggest compensating for impaired skills at the height of a flare, and then it would be a case of gradually increasing those skill challenges, but in line with social, emotional and mental health well-being as the child recovers. And then once the child is kind of out of the flare, it's about checking whether those impaired skills have gone back to baseline, and if they haven't, with consent, sharing that with the team, so that the health professionals involved are also aware that some of those impairments are now becoming longer term. And I think it's important to think in terms of our SEND support system and the fixed linear SEN cycles of graduated approach, assess, plan, do and review, for example, may not be as appropriate in severe cases of PANS and PANDAS. And this is a wide-ranging cohort, and every child is different. And that's because the needs can be of abrupt onset and very severe very quickly. So we need an agile kind of response from the education system. And that also includes in terms of timely applications for education, health and care plans, because we know a lot of our children go on to need these things. And if I could say one key thing, it would be around capturing that baseline for that child at onset. And remember that onset might be a really long time before diagnosis, but then it's really important to respect that baseline and to remain aspirational for our children based on their original baseline before the first reported onset symptoms. So it's important as well for EPs to think about this anticipatory planning for flares and managing these fluctuating needs, but also in terms of when a child is assessed, the outcomes of that assessment are going to be hugely variable depending on whether a child is assessed at the height of a flare or during recovery. And then it's important to slot that into the wider context and picture of their recovery, of their reintegration, of remaining aspirational for these children, and then looking about what can provide them with the most effective educational model moving forward.
Lovely. Thank you, Tina. So it sounds like there's another area of work is really kind of that systemic work as well, in supporting expectations across the system. And I guess thinking about that space for recovery and repair during those flares, and allowing that narrative, that shared narrative with school and home, to allow that young person to have some time to recover. And then, as you say, re-establishing where we are after that, and whether assessment is needed to understand where the skill set is now for the young person, where the areas of strength and need are, and whether that's changed significantly as a result of flare-ups or multiple flare-ups over time. So can you tell me a bit more about any of the systems or project work that you're involved in at the moment that you might want to share with us?
Yes, I can. So there are multiple different streams of work going. Some of them are in health and in education. So do you want to lead first with the health ones, Vicky?
Yes, lovely. Thank you. So yes, we're working in quite a novel way at the moment. And one of our major work streams and a real focus for next year is our PANS PANDAS steering group work. So with support from NHS England and the Department of Health and Social Care, we formed a steering group with representatives from a number of the medical royal colleges across the UK, as well as other key stakeholder organisations. And we're working together to address the variation in care. So the steering group has oversight of 4 working groups. One of them is a research working group where we are looking to launch fairly soon a surveillance study to better understand prevalence of PANS and PANDAS in the UK. And that's really exciting. It's one of the first pieces of NHS-led research that's going on in the UK. There is a clinical guideline development group. So we are working very closely with the Royal College of Paediatrics to develop a clinical guideline to support clinicians, because at the moment they don't know how to manage these children. So this is going to support them. So that's a really big chunky piece of work that's being done at the moment. We have a pathway development group which will launch. It's not actually active at the moment, but will launch to coincide with the publication of the clinical guideline so that we can make it really, really clear exactly who is responsible for looking after these children and what pathway GPs should be sending these children onto. And then there is the Education, Social Care and Health group, which Tina co-chairs, and so she'll be able to give you a bit more information about that particular piece of work.
Thanks, Vicky.
Yeah, so we're aiming to produce local authority guidance. It's going to be advisory, and it's aimed at social care, health and educational professionals. It's covering issues such as the principles for early identification, that assessment, support in schools, and also transition into adulthood. Because as Vicky mentioned earlier, we know that not all children grow out of this condition. We've got families and a young person with the condition sitting within that group, and it's their lived experience and their explanation really and experiences of the barriers to their care and support that are really at the heart of the principles of the group. Mm-hmm. And some of the other areas that we touched upon earlier that the guidance is going to try and cover includes this overlap with neurodivergence, and another part, a really sensitive subject, but also about the safeguarding issues within these conditions, because many of the symptoms themselves, for example, sudden behavioural changes or emotional distress, eating restrictions, can mimic abuse or neglect indicators. So it's about having those really secure and sound principles around that to ensure that families aren't referred for safeguarding if it's a case of PANS and PANDAS.
Yeah, of course. And it sounds like the guidance would be fantastic, especially, thinking about as an EP. If I had a case of a young person with PANS or PANDAS, that would be kind of my go-to, really. What's the guidance? What do we know? Because we don't come across many young people or families, certainly in my role, with PANS or PANDAS. So actually hearing about this today is really interesting and really is raising my own awareness. So I think the first thing you would do is go to your website and then go and have a look at what guidance is there from either the NHS or from local authority education guidance. So I think that those projects that you're working on sound fantastic, and I'm sure will be really valuable guidance to many professionals working with families and young people. So if we were to think a bit more about kind of your charity, your mission, the key messages that you were hoping to get out today and across all of the amazing work that you do, what would those key messages be that we really want our EPs to take home today?
Oh, well, where do I start?
Sorry, Vicky, big question.
There are so many things I want people to know, but I think for this audience, and if I have to choose, which of course I do, I think I would say initially, look out for a sudden change in a child. That's the key thing. If there is a sudden change in personality or behavior, or you just, the teacher or the parent is saying something is different, and I don't know what it is, but they're behaving in a way that I do not recognize, consider PANS and PANDAS, because it's that sudden change that really is the thing. And regardless of the symptoms, children do look very, very different when they've had this. As Tina mentioned earlier, our community experience a disproportionate number of safeguarding and fabricated and induced illness accusations. So whilst we always encourage professionals to take their safeguarding responsibilities very seriously, I think it's really important to say that. Mm-hmm. Symptoms of PANS and PANDAS can mirror those of the safeguarding red flags. And so we would ask you to be mindful of your approach, And also, I wanted to just highlight that we have actually written a really excellent FII and safeguarding guide for professionals to help them look at their safeguarding responsibilities through the lens of PANS and PANDAS. So I would definitely recommend. It's free on our website for professionals to download. So I would do that. What else? I would say that the symptoms can also mirror those of autism and other neurodevelopmental disorders. So and then to further complicate things, it's also really possible to have autism and PANS and PANDAS. So you might have a child who doesn't have autism that develops PANS or PANDAS that suddenly looks as if they have autism. Or you could have a child who's always had autism who then changes and they have, this sort of exacerbation of new and different symptoms. In both cases, that both things can happen, and it can make it quite difficult. Remember, the condition is often relapsing and remitting. So a child may have symptoms one day and a month later, they may have no sign of those symptoms and they may be absolutely fine. And then they might get those symptoms again a few weeks later. And the symptoms can change from flare to flare. And then I think, finally, my most important message is, remember, this is a biological illness that requires treatment with medicine from a doctor. It's not a behavioural disorder. It's not a mental health disorder. It's not a parenting issue. It is, the child is not able to control what's going on inside their brains, and they need support and understanding and acknowledgement that this is a health issue. I think those are probably the main points. I mean, I could go on, but I won't. I'll be good.
Thank you, Vicky. My next question was about how educational psychologists can support families further than maybe just kind of thinking about the classroom practice. And as you were talking then, Vicky, it was making me think about the importance of multi-agency working and having EPs to potentially advocate for the needs of young people, liaise with medical professionals, and really make sure that those two systems are talking to each other, as well as supporting parents through what could be quite a challenging time, I would imagine, actually, when it's not known. There's a lot that's not known about PANS and PANDAS. So if a parent who's trying to advocate for their young person and there isn't that knowledge in the system, that could be really challenging for parents. So I'm just wondering how, what your views are and how we can support families as well.
So I would say, from my perspective, it's about having PANS and PANDAS in your professional toolbox. So if you see sudden regression or behavioural spikes occur, just think about, could it potentially be? And advocate for that medical review. And also, it's a really rapidly growing and changing and evolving area. So being up to date with what's going on in both health and education, I think is really key. And then it's about that swift identification and referral, providing that key information for the GPs, perhaps a symptom checklist, including all the domains that you might see some needs in, that timeline of onset, severity, and of course, all of those different types of observations in different areas. And then it's about also signposting other professionals that would be involved, as you've said, about this multidisciplinary approach, and also signposting them to information and not making assumptions that they will know or understand their condition, certainly at this stage. And then I think for parents, it's really helpful if they can be empowered with clear language for describing those symptoms for themselves, keeping a diary of those key moments and how that can be effective, and validating and listening to their concerns. And then within the professional networks, counteracting misconceptions that PANS and PANDAS are behavioural or attachment disorders or due to poor parenting. And it's about recognition as well that it affects everybody in the family. Everybody has to shift to cope with a flare, and everybody has to shift again when the flare, starts to die down a little bit. And that's everybody in the family, and that includes siblings. And siblings are so often forgotten in families with PANS and PANDAS, but their whole world can turn upside down with these conditions as well. So it's about having that care and nurture for them as well, and recognizing their needs. And then there is quite a lot out there now. We've got teacher training, we've got educational psychology training, there's lots of articles, there's lots of resources, Twinkle, Send Network, lots of organisations now hold information about the condition. And then a really big part of the jigsaw or the story missing in terms of education in PANS and PANDAS is the lack of research. So if any EPs are interested in this as an area of emerging research, it's very much needed.
Brilliant. Thank you so much, both. It's such an interesting topic, and clearly the work that you've done is amazing. And I think this would be a really helpful podcast for EPs to understand more about PANS and PANDAS. And so thank you so much for your contributions. And that is the end of our episode. So thank you for joining us, and thank you for all of our listeners.
Thank you
for having us.